Yes, India is currently experiencing a mild resurgence of COVID-19 cases, primarily driven by the Omicron subvariant JN.1 and its offshoots like LF.7 and NB.1.5. Current situation as of May 21, 2025. Active cases, 257 nationwide. Most affected states, Kerala, 95 active cases. Tamil Nadu, 66 active cases. Maharashtra, 56 active cases. Other affected areas, cities like Mumbai, Chennai, and Ahmedabad have reported a noticeable uptick in cases. Severity. Most infections are mild, with symptoms such as cough, cold, and low-grade fever. Hospitalizations and ICU admissions remain low. Fatalities. 2 deaths have been reported in Mumbai, both involving individuals with pre-existing health conditions. Causes of the surge. New variants. The JN.1 variant and its sublineages are contributing to the increase in cases. Environmental factors. In Kerala, high humidity and fluctuating temperatures may be weakening immunity and facilitating virus transmission. International travel. Increased travel has been linked to the spread of new variants. Government response. Monitoring. Health authorities are closely monitoring the situation, with regular reviews by the Ministry of Health. Testing. Enhanced testing for individuals with influenza-like symptoms is being conducted, especially in affected areas. Vaccination. Efforts are underway to encourage booster vaccinations, particularly for vulnerable populations. Precautionary measures. Masking. Wearing masks in crowded or enclosed spaces is advised. Hygiene. Regular hand washing and use of sanitizers are recommended. Vaccination. Individuals, especially those at higher risk, should ensure their vaccinations are up to date. Avoiding hotspots. Limiting travel to areas with higher case numbers, such as parts of Kerala, is advisable. Conclusion. While the current rise in COVID-19 cases in India is relatively mild and under control, continued vigilance and adherence to preventive measures are essential to prevent further spread. As of May 21, 2025, several countries are experiencing a resurgence of COVID-19 cases, primarily driven by new Omicron subvariants such as JN.1 and LP.8.1. Here's an overview of the current global situation. Globe Global Overview. United States. The LP.8.1 subvariant, part of the Omicron JN.1 lineage, accounts for approximately 70% of recent cases. The U.S. FDA is considering updating vaccines to target this strain. Europe. Similar to the U.S., LP.8.1 is becoming dominant in parts of Europe, prompting the European Medicines Agency to recommend reformulating upcoming COVID-19 vaccines to target this subvariant. Globe Asia. Singapore. Weekly cases rose from 11,000 in late April to over 14,000 in early May, with hospitalizations increasing by approximately 30%. Hong Kong. The positivity rate surged from 1.7% to 11.4%, with 1,042 new cases and 30 deaths reported in the week of May 10. China. Hospital test positivity rates have doubled over 5 weeks leading up to May 4, nearing last summer's peak levels. Thailand. Following the Songkran festival, cases have spiked, with 2 significant cluster outbreaks reported. Malaysia. As of May 18, daily cases increased to 164, with no new deaths reported since April 25. The Ministry of Health has heightened preparedness measures in response to regional surges. Globe Other regions. Australia. National case numbers remain low, with 2,795 new cases reported in the week ending March 21. Positivity rates and flu tracker data indicate a stable situation. Africa. As of February 2025, Africa reported over 9.5 million total cases and approximately 175,000 deaths. Recent data on current trends is limited. DNA variants and vaccination. Variants. The JN.1 variant and its sublineages, including LP.8.1, are contributing to the current surge in cases across multiple regions. Vaccination. Efforts are underway to update vaccine formulations to better target emerging variants like LP.8.1. Intranasal vaccines are also being explored as a potential alternative to traditional injections. Brain key takeaways. The current global rise in COVID-19 cases is largely attributed to new Omicron subvariants, particularly JN.1 and LP.8.1. While many infections are mild, certain regions are experiencing significant increases in cases and hospitalizations. Health authorities are actively monitoring the situation and considering updates to vaccine formulations to address emerging variants. Preventive measures, including mask wearing and avoiding crowded places, remain crucial, especially for vulnerable populations. If you have specific questions about a particular country or region, feel free to ask for more detailed information.